Hello, and welcome to episode number 6 of the GLP-1 Hub podcast. My name is Anna Reisdorf. I am your host. I'm a registered dietitian, but also a GLP-1 user. So before we get to this week's guest, I want to introduce you to our very first sponsor. This is a new podcast, so we don't have a bunch of sponsors just yet. So this is our very, very first one. I'm very excited to tell you about Resist bars. So Resist bars are a snack bar. And I've literally never seen macros this good on a snack bar. Each bar has 12 plus grams of protein and 14 grams of fiber. And so the owner decided to create these bars to help manage her own PCOS and blood sugar imbalances, but it's literally perfect for people on GLP-1s. It also has no artificial ingredients, no natural flavors, no inflammatory oils. It is vegan, keto, soy-free, gluten-free, just all the things that you are looking for in a snack. And they were so gracious to offer our listeners 15% off. And I'll put the link in the show notes, but you want to go to eatresist.com /discount /GLP-1 Hub. And you can get 15% off your first order of these like literally macro perfect bars. You're going to love them. Great for snacking if you're not feeling very hungry on a GLP-1, but you still need to get your protein and carbs in. So let's get to the episode. Today we have Dr. Harry Oken on to talk all about side effects of GLP-1s and what he's seeing with his patients and some ways to manage those side effects. So let's get to it. Welcome to the GLP-1 Hub podcast. I am so excited today to have Dr. Harry Oken on, and he is going to talk about GI side effects and side effects in general of GLP-1 because we have had so many questions about that. So Dr. Oken, please introduce yourself so that people can learn more about you.
Thanks. Well, I'm a practicing internist, and this is my 37th year in practice, and I've had a wonderful career, I think mainly because I've been involved in so many different things. The principal thing I do is take care of patients, and I have a wonderful practice with terrific patients, and my goal all along with taking care of patients is to keep them healthy rather than treat their disease. Of course, there are always diagnostic situations that come up that we have to use our best efforts and sometimes keep chipping away to come up with what's causing problems. But really, in the big picture, I'm very interested in preventing problems. So I always think about how we age in 4 ways. And there are really 4 pillars to how we age: good nutrition, regular exercise, restorative sleep, and controlling stress. And so they sort of hold up our immune platform, because it's our immune system that actually changes, that makes us more susceptible to illness. And so when your immune system is not balanced with those 4 pillars, that's when we get into trouble. And really, at the basis of probably almost all disease is inflammation. And so when there's inflammation, there's the potential for problems. And you can basically take just about any disease entity and come up with that conclusion. So, in the American diet, of course, our diet has changed markedly over the years, and it's gotten worse with food additives and how foods are manufactured to make us seek them out. And some people referred to this as the obesogenic diet. We have an obesogenic diet, meaning foods are formulated to taste good, maybe salty, maybe sweet, maybe fried, and cause our pleasure center to respond to that and want more and more. And when we talk about GLP-1s and GIP drugs, such as semaglutide or tirzepatide, we're talking about one of the biggest impacts that it has is affecting our pleasure center. And so what I always hear from my patients who are using these is that they have a sense of no more food noise. I'm not as hungry. I'm not seeking. I'm not foraging. And I think that's probably the biggest aspect of what we're seeing in terms of success, is this change in behavior and not reacting to our obesogenic diet. And so that's where I really see the core of all this. I've said for many, many years, and basically talking about weight is part of most interactions in my practice. Are you at a healthy weight? What should be a healthy weight? And that's really sort of one of the major things that we deal with in preventative internal medicine. So I think that one of the things that I've always known for many, many years is that the core of obesity is really brain signaling. And if we can affect brain signaling, we can make improvements in healthy weight.
Mhm.
And the GLP-1s and the GIPs are, to some degree, a big reason why we're seeing success, because it does affect brain signaling. And, everybody who's tried to lose weight, oftentimes they say, okay, on Monday, I'm going to change my diet. And by Monday afternoon, they may have not made any success. Years and years ago, I had a chef who was a patient of mine, and he was very large. He weighed about 300 pounds. And he said to me one day, he said, every day I think to myself, today's the day I'm going to start my diet. And by midday, I'm in the kitchen preparing food for other people, and I make myself a really super small sandwich. And I think, that's all I'm having today. At the end of the day, I added up how many small sandwiches I made, and it was a lot of small sandwiches because I couldn't help myself. That's the brain signaling that I think GLP-1s and GIPs modulate.
When you see a patient, you said you focus on those 4 pillars, which I agree are extremely important. So when you see a patient, do you start with trying to help them with those 4 first, or do you go to the GLP-1 or medications? Like how do you
So, every patient is very, very unique, right? So many times you can have a good discussion with somebody and motivate them, and they don't need anything but themselves. And that does happen. I had people say, I saw a picture of myself on this cruise with my sister, and I didn't recognize myself. I can't believe I've gotten that big. And just that picture of seeing somebody, of seeing themselves, sometimes that's enough to invoke the brain to make changes. And we call that a keystone phenomena. And that keystone phenomena can be very, very powerful. I've seen it before in, for instance, couples that one person is very unsatisfied with the appearance of the other person. They say something, and that's enough to really motivate people. So I wouldn't underestimate the power of some people's discipline and habit formation to say, you can do it on your own sometimes. But by and large, the bigger somebody is and the longer they've been in that position, the more difficult it is for them to lose weight. And that's because the brain's pleasure center makes neurologic circuits that we're always going down the same superhighway. When you change that superhighway and go down a different way, as long as you keep going down that different way, you make that highway faster and stronger. But it's really easy, and what we've seen in people who have lost a lot of weight, whether they've lost it from exercise or they've lost it from change in their diet or both, if they go back to their old ways, they rapidly gain back the weight. That's because that previous superhighway of how we eat and how we process is there. What we don't know for these drugs is, and I'm hopeful that this is going to be the way it is, what we don't know is if you're let's say you're on semaglutide, which your viewers may know as either Wegovy or Ozempic. Okay, let's say you're on that for a long period of time and you've taken your weight from 200 pounds maybe to 140 and you feel great. If you stay on that drug for a reasonable period of time, does it mean that your brain changes so that when you start to withdraw the drug, you can stay there? We don't really know the answer to that. And what I'm saying is a long time is not 6 months. I'm thinking many months, maybe 24 months, maybe 36 months, because the brain is going to form new neurologic circuits to get used to not eating between meals, get used to not craving sweets, get used to not sitting in front of a computer, maybe eating a bag of potato chips. The brain will get used to that. And so what I've done for a lot of my patients who reach their goal is, and this is an example of a great case. I had a man who was in his late 60s who was a diabetic, hypertensive, high cholesterol, degenerative joint disease, and sleep apnea. He was only 64 inches tall, but he weighed 195 pounds. I put him on tirzepatide, and really rather quickly, over about 8 months, he went from 194 to 1. Okay. And he felt great, looked great, and his blood pressure normalized. His diabetes is now in total remission. His cholesterol is better, but he still requires a statin. His back is no longer killing him, and his sleep apnea is gone. So what we did for him, and this is about 18 months going. What I've done for him is, I have now said, All right, let's see if we can decrease the amount of drug that you're on. And I want you to start, instead of giving yourself every 7 days, I want you to give yourself every 8 to 9 days and only inject yourself when you start to feel hungry again. Okay. And now he's out about 15 days from injections and he's maintaining his weight because ultimately nobody wants to take medication. But in this case, the value of being on this drug is so outweighs any side effects that he would get from being on the drug. Because when you look at, here he is at 69, I no longer have diabetes or it's in remission. My joints don't hurt. My cholesterol is better. My blood pressure, I'm no longer on blood pressure medication. We've really changed his risk significantly.
So I have a question about that because
Yeah.
I started my career working with people who had gastric bypass.
Uh-huh.
And gastric bypass, after 10 years, people do start gaining the weight back. And there's some degree of metabolic adaptation, right? Where if you've always weighed 150 pounds, your metabolism is faster than somebody who lost weight over time. So I'm curious, in 10 years, like, is the weight, even if you stay on it, could the weight possibly start to creep back up? Do you need more of them? Is this a question that we even know the answer to?
Yeah. Yeah, I think there's definitely an accommodation. Now, one of the things that happens naturally beginning at age 30 is we start losing muscle mass. If you can put on lean body mass during this time, you're offsetting. For every pound of lean body mass that you bring in, you're increasing your basal metabolic rate by about 50 calories. So one of the key things that I get my patients to do is when we put them on these drugs is make sure that they commit to doing some resistance exercise, because there's nothing like losing a lot of weight and being able to say at your scale, well, I went from 180 to 150, but I don't look any better because now I'm sort of like a prune, because not only have you lost fat, but you've lost muscle. So it's key actually to even augment your weight loss by doing resistance exercise, because maintain the muscle, build muscle, you'll look so much healthier. That's it's a key phenomena when you're prescribing these drugs, for the prescriber to be crucially aware of it. And I prescribe these regularly, mainly because I'm interested in decreasing inflammation and helping patients with all their comorbidities. And it's been a real game changer. But I see my patients regularly for this. I don't just give them a prescription and say, see you in 3 months. I see them the first dose is always given in the office. And so we can go over the risks, benefits, side effects, what to expect, what not to expect. And then I see him at 4 weeks after the first dose. And then we have a decision whether to increase the dosage or change the dosing interval. And then I see him at 6 weeks and 8 weeks. And eventually I'll see him every 3 months. But I found these drugs to be very, very safe if they're given in the right manner, with the right diet, with the right understanding. Very few times these days am I discontinuing the medication for people.
So let's talk a little bit about the side effects, because that's really what my audience seems to be very curious about, particular digestive side effects, nausea, vomiting. I mean, you're aware of those. So what are your thoughts around that? What are you seeing, and how can we reduce that?
Well, of course, that's the number one side effect. But clinicians will always get the question of, I injected myself in my belly and I have a rash. What do I do? Okay, we've seen that. That's a really common thing. It may not even be from the drug. It may be from the vehicle. And I always tell people the rash will go away. If it's itchy, put a little over-the-counter steroid on it and make sure you're rotating your sites. Now, from a digestive standpoint, here's what I see, and here's how we try to mitigate it. First, from a digestive standpoint, the first time you get introduced to the drug, you probably are going to have the most significant side effects, or each time you incrementally increase the drug. And normally it's a little bit of nausea, okay? But you have to make sure that you've given people a lot of warning about that. When you first start using the drug, make a conscious effort to eat slower and to have less, because there's nothing like eating too much right after you've had the drug on board. And remember, when you first inject the drug, you're going to see a peak, okay? And then it's going to come down to the level. And that peak may make you feel worse at first. So it's not unusual 3 hours to 12 hours later to have a wave of nausea or feel distended or bloated. So it's really important around the time that you give that injection that they understand, stay well hydrated. That'll go right through your stomach. But if you eat, and you eat foods that normally are going to cause delay in gastric emptying, you may feel fuller. So if you decide you're going to have a sandwich with cheese and mayo on it, that actually is going to cause a little bit more delay in gastric emptying. And if you eat the whole sandwich instead of half or a quarter, you might feel pretty bad, like you feel 20 times worse after Thanksgiving. And you can't really predict. Some people have nothing. Other people feel distended, bloated, full, nausea. Some people also tell you that they have food aversion when they first inject. Like, I just don't even want to think about food. Almost like you feel when you get coming down with a gastroenteritis. Now, to mitigate that, I always tell people, your first injection, and each day when you're 7 days later, you're giving yourself a next injection, you got to really be smart about what you're eating. Hydrate, small meals, stay away from fatty foods that will probably cause some delay in gastric emptying, and find out what works for you, because it's different for different people.
Right.
Now, these drugs also affect gastric motility. I see this more commonly with which is Wegovy and Ozempic, than I do with tirzepatide, which is Zepbound and Mounjaro. But it will slow down your colon. And so some people will feel distended and constipated. Curiously, there's a group of people that will get diarrhea. I don't know what that's all about, why some people will get very slow and be constipated and be distended, and other people won't. But if you eat a reasonably high fiber diet, lots of fluids, more protein, less fat, less carbohydrates, it's generally very well tolerated.
And so we connected over product Relesium.
Right.
So that is a product that helps support digestive health. Can you tell me a little bit more about it? Because
Sure.
I've been using it. I'm a GLP-1 user too. So I've been experimenting with it a little bit. So I'm curious what your thoughts are.
Let me tell you a little bit about this. So I've been involved in a lot of different things, and I'm on a variety of scientific advisory boards. And one of the scientific advisory boards that I've been on is through the company that makes Relesium, which is called Pantherix. And Pantherix actually has had a product for a long time, which is bovine colostrum. And we'll talk a little bit about colostrum in a bit. But initially, bovine colostrum is used as a nutraceutical to support different things. And colostrum has just a lot of interesting properties. As you know, colostrum is the first week or so of breast milk in humans. It contains antibodies and growth factors. And the same thing's true for bovine colostrum given to calves. And so it helps with immune support. It helps with the gut barrier. And so it's a very soothing, interesting product. On my role as the chair of the scientific advisory board for Pantherix. And we've used this supplement in a lot of different venues. One of the products that the company makes is something called Diarescue, which is actually for diarrhea. It's particularly helpful for children who have gastroenteritis. And it's been found that if you take this for diarrhea, different than Imodium, it seems to soothe the gut and stop the diarrhea rather quickly. Well, the other thing that colostrum does is it protects the inside lining of the stomach. So people who are taking nonsteroidal anti-inflammatories who take colostrum seem to get some protection. So it's good for immune support. It's good for protecting the gut barrier. It has a lot of potential applications for managing infectious diarrhea, supporting gut health, and it's a really interesting product. Well, we started to realize that this was very helpful for people who are having digestive upset in patients who are using the GLP-1s and GIPs. And we actually did an observational study where we gave this to people who were initiating use with either semaglutide or tirzepatide. And that study is actually a poster presentation that's going to be presented at the American Nutrition Society meetings in June. And what we found is that most people who took this product found that it helped manage their nausea and overall improve their digestion. So it was just an observational study where we had people fill out questionnaires. We provided the product. Now, the product is not just colostrum. It also has egg powder in it. And egg powder is kind of interesting. It comes from eggs, and it's a protein that contains a immunoglobulin called immunoglobulin Y. And we found that this is very supportive of the gut. So it targets immune support, but there are these antibodies within the eggs that provide passive immunity to the bird's offspring, but it can be extracted for human health. And unlike antibodies, the IgY that's in it doesn't activate something called the human complement system. So it doesn't have the sort of side effects that you would get if you were taking human immunoglobulin orally. It's stable, it's very resistant to digestion, and it actually helps to neutralize specific pathogens in the gut. So one of the things that I want you to envision is that if you are a GIP user or a GIP user, you're slowing your gut, which means that the natural microbiome in your gut may be changing. You're slowing your gut also, and that means that you may have a larger amount of residual in your stomach and you'd be more likely to have reflux.
Hmm.
So what we found is that patients report less reflux, less bloating, less nausea. And the typical user, and I oftentimes give this to patients when we start this and say, look, you can either take it when you give your injection, or you can take it after the injection if you feel nausea or bloating and see if you get some relief. And most people we give it to get relief. And the mechanisms are multiple mechanisms that we're just beginning to understand, but a lot of it has to do with its effect on GI motility.
And so if you wanted to start using it, you said around the injection time, but is it something you can use every day? And I noticed that, I'm a collagen in my coffee type of person,
Mhm.
but it says on there, don't put it in hot stuff. So,
Right.
so what is the best way to add it to your routine?
Yeah, some people are putting a scoop in yogurt, okay, and having a small yogurt meal. Some people are just putting it in water. Some people are making a smoothie. That's what I've been seeing and seems to help. But a lot of people just put it in water and drink it down.
Okay. And
Yeah.
it's just one time a day, usually, that you
You can
recommend?
use it up to 3 times a day if you need to, particularly if you're having loose stools. And it generally helps people. Yeah.
And so you mentioned kids with diarrhea and a stomach virus or whatever. I technically give this to my kids if that happened to them?
Absolutely. There's a pediatric formulation you can buy online
Hmm.
called Rescue. And it's the same thing. It's bovine colostrum and an egg yolk. And the active ingredient in the egg yolk is immunoglobulin Y.
Hmm.
And it seems to be very helpful for people.
So
And it's not Imodium, so you're not going to paralyze your gut. Or, some people do get into trouble with Imodium, get terrible constipation, which, as you know, is, one of the problems that people have with GLP-1s and GIPs.
right. So with the slowing down of the motility of the stomach and the change in the microbiome, do you recommend any kind of probiotic to counteract that or anything to support the microbiome, or is that change good?
Yeah. So, everybody has their own absolute unique microbiome signature,
Hmm.
right? So, and it's largely determined by what you eat. So if you eat well, you'll have a better signature as far as we know. We also know it's interesting that, there are different types of microbiome that are available that are in people who are either lean or obese. And it turns out that one type of bacterium is more likely to be in obese people versus lean people. So your microbiome, when you lose weight, is going to change.
Hmm.
And hopefully it's going to change in a positive way. There's no downside in trying a probiotic just to manage, bloating, loose stools. Most people who take probiotics actually generally report that they think it's better for the digestion. But, that's a probiotic. If you're getting a lot of prebiotic fiber, which you can get from lots of fresh fruits and vegetables, you're going to manage it as well. And your average person in America is very deficient in fiber. Most Americans get less than 15 grams of fiber a day, so they're woefully deficient in fiber.
Hmm.
I usually tell people go for 25 to 40. Don't do it all at once because you'll pay the price because
Yeah.
your bacteria are going to react to that. For every gram of fiber you make, your bacteria is going to make 2 grams of fiber. And the bacteria make really good stuff. They make short chain fatty acids,
Hmm.
which are very anti-inflammatory. So it's really important to get the right mix of fiber. Well, to get enough fiber. And fiber is so important for the health of your colon for a lot of different reasons, not just for the microbiome.
So there have been a lot of concerns lately with the changes with the compound version of these medications possibly being banned by the FDA. There's just a lot of confusion and insurance companies maybe not covering it. And, it's quite expensive. So what are your thoughts if somebody is afraid they're going to have to at some point get off of it, or they can't get it
Yeah.
covered anymore, or can't find it?
This is a challenge that the FDA and medicine in general has to really meet because, as you know, if you're buying proprietary pharmaceutical grade brand, it's going to be pretty expensive. Now, I understand the makers of Zepbound have decreased the dose, decreased the price a little bit, and also made them available in vials so that you can maybe calibrate more specifically how much you're giving. And I think the same is true for semaglutide. I think that obesity is definitely a illness. It's a disease, and we need to step up and use the best tools that we have to help with that. Because if you're overweight, if you're carrying a lot of weight and you have a large percentage of fat, you are inflamed. And that fat is very active. It's secreting a lot of different things. And if we can if we can make you better by making you leaner, we are contributing to your overall improvement of your inflammatory index. So we have to really get in on this. To answer your question specifically, how do I feel about compounded drugs? And I think you have to be very careful of who you're getting it from. A lot of the compounding pharmacies are what are called 503As, which means that the FDA places a lot of scrutiny on them and that they have to submit lots for evaluation and purity. I think if you're getting it from a compounding pharmacy, you'll want to look for a pharmacy, and I certainly send patients to those pharmacies now. However, I believe possibly beginning today, March 19th, there is a new ruling that has put an end to compounding pharmacies right now. Now, that may change. I think the compounding pharmacy groups are working to see if they can figure out a way around this, but it's going to definitely impact some people who are getting some valuable improvement in their health.
Yeah. Yes, I have a friend who's been just using the compound one. I don't know why she didn't go to her doctor to start, and she's freaking out.
For a compounding pharmacy to prescribe it, you have to have a licensed physician or nurse practitioner to prescribe it. So for instance, in my practice, what I'll do is if we can't get this through your insurance, I will give them the name of the group that I use. I prescribe it, and then the vial gets sent to them. And it's significantly less expensive through compounding pharmacies, but you just want to make sure that your healthcare provider, knows of where you're getting it from and feels that the purity and safety is good. I don't think we're done with compounding pharmacies for these GLP-1s and GIPs. I think there'll be a way, hopefully, to make sure that people who are benefiting and improving their health have access to them affordably.
Good. I hope so. So do you have any final thoughts about the future of these medications? Because every day I feel like there's a new benefit. Sleep apnea, heart health, all sorts of things. So where do you think we're headed?
Well, every single disease entity that I know of that has been measured in people who are using these drugs to attain a healthier weight has improved. Heart failure, sleep apnea, certainly metabolic syndromes, but even degenerative joint disease. Now we found actually that some people are more fertile who are actually using these. And then, of course, we have the whole dementia issue. There's data now that's being generated, not just as an indirect effect of losing weight for cognitive improvement, but even a direct effect. So we yet to see that. But the future is really interesting because now that we understand the GLP-1s and GIPs a little bit more, new targets, other receptor pathways are being identified that may make better drugs that may be instead of once a week, once a month, or once every 6 months, and oral compounds. So I think now that we understand how our system has become jumbled up from the way we eat and the way we exercise, we have a way of reordering it. And I think the sky is the limit, and we're going to see that people who are interested in their health and want to use with caution and good advice these drugs, I think we're going to see a real improvement in the overall health of our country.
Good. I think we need that for sure. Anyway, I want to thank you so much, Dr. Oken, for coming on. This is such a good conversation and really aligned with, I think, our listeners are really going to like it. And I will put the information about the product that we discussed, the Relesium, in the show notes so you guys can figure out where to find that. And I want to thank you again for coming on.
You are quite welcome. It's been my pleasure.
All right. Thank you so much for listening to this episode of the GLP-1 Hub podcast. We really want to stay connected with you, so be sure to join our Facebook group. It's called the GLP-1 Hub group on Facebook, Support and Community. I'll put the link in the show notes. Make sure you're following us on Instagram at GLP-1 Hub. And then also we are on YouTube at GLP-1-Hub. And over there, I'm sharing more personal stories of my own journey. You can also watch the podcast episodes on YouTube if you're not watching on YouTube. So make sure you are connected. And then we also have some nutrition guides that our dietitian team created to help you on your journey to make sure you feel like you're doing the right thing and eating the things that you're supposed to be eating. But you know what can help you get there is the Resist bars. So thank you so much to our sponsor, Resist Bars. And don't forget to check out their link for 15% off your first order of bars to our GLP-1 Hub community. And I'll see you guys next week.